Hello and welcome everyone to Yashoda Hospital's online segment Know Your Doctor session. Well, in today's episode, let's discuss about heart health and how to keep it healthy. I'm Dr. Lakshmi and let's welcome Dr. D. Sitaram, consultant cardiologist from Yashoda Hospital's Malakpet. Welcome, doctor.
Hi.
So doctor, I think most of us have this one question on our minds. Why young people who are healthy and fit collapsing and dying all of a sudden? Did you experience this in your clinical experience?
Yes, that's a very interesting and pertaining question. And today that is the most difficult question to answer, and most of the people have that question. Why do younger people who are otherwise healthy are having heart attacks? So the studies show that recent times there is an increase in the incidence of heart attacks. The number is increasing, the severity of heart attacks is increasing, and more younger people are getting affected with heart attacks. And you might be surprised to know each year there is a 2 to 4% increase in the risk of death in young individuals. Young individuals, I'm talking about people who are less than 40 years of old. Imagine, people of less than 40 years of age are dying of sudden heart attacks, and these heart attacks are massive. Most of them are not even having time to reach the emergency room.
But doctor, despite there being more awareness about the general health benefits of exercise, diet and fitness, why do you think this is occurring more common?
Yes, this is the most common question that a particular person asks us in the office. They come and say, see, otherwise so-called healthy people who look healthy, who stay fit, who appear fit are having heart problems. What could be the reason? The reason is a bad lifestyle. See, more and more people are having alcohol intake, smoking and sedentary lifestyle. With the recent increase in the number of these COVID cases, the post-COVID scenario also has an increase in the risk of clot formation. The clot formation can occur either in the heart or the brain or the legs or the lungs. So the post-COVID scenario, although the COVID can be mild or it might even got unnoticed, but the risk of a major heart problem occurs in the post-COVID scenario. Another important is the bad lifestyle. Now with the work from home, most of the employees are at home, they are working from home. This makes them more sedentary, and to so-called boost the immunity, they are increasing the diet intake. This improper diet intake and improper exercise, inadequate exercise and sedentary lifestyle is putting them at risk of heart problems.
So you just said that they think they look fit or they think they are fit. But from cardiologist's point of view, what does fitness mean?
Yes. So most of us are living in a generation who wants instant results. They want to go fit instantly and they want to transform the body with particular targets. They have a particular target, they have a wedding function at home. They want to look good or feel good in their favorite dress. So they have an operation, what we call Operation #fitness. So they have instant goals. So most of them are having improper diet. This improper diet is the major cause of the increase in heart problems and other health problems. So people are having more of liquid diet. So if you look at people who are having liquid diet, most of them have either a cup of green juice or a glass of green juice or lemon juice or buttermilk in the morning. So they are increasing the risk of missing a balanced diet. So most of the green juices, which are not properly prepared, have a high content of oxalates. These oxalates increase the risk of kidney problems. And most of the bottled juices which are bought online are not pasteurized. So unpasteurized drinks take the increased risk of germs that are entering into the body. And most of the juices which contain only lemon act as purgatives and laxatives. So they cause severe diarrhea. So severe diarrhea can cause loss of minerals and electrolytes. This can lead to serious heart problems. For suppose a person who has a severe diarrhea can have severe hypokalemia. So a minor heart attack can transform or progress into a severe heart attack with leading with cardiac arrhythmias, which can lead to sudden death because of hypokalemia.
So doctor, undoubtedly that screening is the most important tool to identify heart disease at an early stage. So how do we screen patients irrespective of their age or gender?
The only way to prevent the incidences of heart disease is a routine health screen. Being an Indian itself puts all of us at a high risk of heart problems. So the only thing which can prevent a heart attack is a routine screen. A properly done preventive checkup can prevent heart attack, can identify disease in the early stage, and we can take necessary medical or lifestyle changes which can help prevent sudden deaths. Rather than aiming at sudden transformation of body or instant results, people should aim at a properly balanced diet and a gradual reduction of weight. People should take more of carbohydrates, fruits, fiber, protein and food that is rich in minerals and vitamins. So if you deprive of calories, totally deprive of calories, you might lose some pounds instantly. But if you do strenuous exercise with a low calorie intake, the heart is strained, the muscles are strained. There is an entity called relative energy deficient syndrome in sports. This is because people are straining excessively, at the same time they are decreasing the calorie intake. The muscles are not having enough strength to burn the calories and to maintain a basal metabolic rate at rest. This might decrease the weight instantly, but the regain in weight is also very instant. Very less intake of fat is also dangerous. This will deprive the body of fat soluble vitamins. I am talking about the vitamins A, D and K. These vitamins are called fat soluble vitamins. You take less amount of fats, these vitamins are not absorbed from the body. So these vitamin deficiencies can lead to deprivation in the immune system. This keeps the body at risk of major infections.
So doctor, we've just discussed that screening is the most important tool in identifying heart disease. So you think there is significant rise in people getting their hearts screened, especially in this post-pandemic period?
Yes, more and more. In fact, the number, if you compare pre and post COVID, the numbers of people who are coming for screening for heart disease is just doubled. More and more want screening because almost now 2.5 years, people have not come for checkups. Now they want to have a fresh checkup and see how their health condition is. And people are affected with COVID. They want to know if they are at risk of heart problem because they have recovered from a COVID illness. So the number of people coming for checkups in the post-COVID era is more.
Yes, that's absolutely right. How many times have we heard that exercise is good for our heart health? So doctor, tell us, is there any particular type of exercise like aerobic or strength training which is really good for us? And how do we know that this is the right amount of exercise is needed for us individually?
So the recommendations from the American Heart Association is we should do a proper exercise of 150 minutes per week. This should be adequate to maintain a proper health. This 150 minute of exercise should be cardio, weight training and strength training, and this should go under the guidance of a proper trainer. Excessive exercise can cause severe osteoporosis and even strain the tendons and ligaments.
So doctor, on a personal note, how do you keep yourself fit and how do you motivate your patients to keep themselves fit?
I would try to exercise at least 5 days a week with at least 25 to 30 minutes of aerobic exercise. I take lots of fruits, and most important is to manage the stress. We as interventional cardiologists has a lot of stress, both physical and mental stress. This is because we want to hand over the patient happily and safely to their loved ones. To manage stress, I think music has a great role. I listen to a lot of music to keep myself stress free. and to take a lot of fruits and to exercise regularly, at least 10 minutes of exercise every day.
So, talking about stress, how does your family react or deal with the stressful job of yours?
That's a quite practical question. As doctors, we have stress during the hospital hours and also at home. We are able to manage our work with a proper and dedicated support from the family. The family and children should equally cooperate with us and understand the necessity of our being present in the hospital at most of the time when the patient needs us. The need of the hour is what they should understand. So my family helps me a lot. They properly understands my needs and they encourage me to be available whenever somebody needs us, and the need of the hour is what is important. So family is also an important stress buster for us. So we get relieved of all the stress once we go home.
I think that's interesting. So, when you counsel your patients to start exercising or to take up any physical activity when they are detected with a cardiac disease, how do they react? I mean, do they take it seriously or do they just brush it aside and just hang on to the medicines?
I usually advise them to take very less medicines. I don't believe in these vitamins and antioxidants. The way we counsel is after properly understanding their daily requirements, their daily lifestyle and their possibility to do regular exercise. We encourage them at regular clinical visits. We keep them targets of decreasing the HbA1c level, lipid levels, weight, heart rate and BP goal. We give them small regular targets and meet them regularly so that we can counsel them repeatedly and reinforce the importance of maintaining the regular lifestyle.
That's right, sir. So before ending this episode, what message you would like to give to the general population as far as heart health is concerned?
Maintain a proper lifestyle, do exercise regularly, avoid smoking, avoid alcohol intake, drink more water, take more fluids. If you binge alcohol, smoke excessively like a chimney, no amount of green juices, no amount of exercise, no amount of this packed food is going to undo the harmful effects of this unhealthy lifestyle. So believe in gradual improvement in health rather than aiming at instant good results so that you could have a good photograph.
So this brings us to the end of this episode. Thank you all for joining us and do watch us for the next week as well. Stay safe and take care.